Good afternoon. It's Betsy with Birth in the Know. I missed my morning video. This is my 14-day challenge that's turning into an everyday occurrence. And I'm changing up the time today. And I'm here to ask a question of the day. And I know I'm usually here, I don't know, before 11 or so, but my day escaped me today. Question today is, if you are over 35 years old and you're pregnant, are you at risk being pregnant because of your age? The answer is you could be. How are you? Are you healthy? What's going on with you? Your age is not the reason or a reason. Just because you are a certain age does not mean that you're at risk. So what happens in the maternity care system when you are over 35? What happens typically is you are told that you must get an amniocentesis, or maybe you're asked if you want it or encouraged. It seems to be an assumption, protocol, something that is very routine. You're over 35, you must get an amniocentesis. And I'm here to say that just because you're a certain age does not mean that you are at risk. Now, you could be if you have some other health problems and other things going on, but your age alone is not reason enough for an amniocentesis. Because what is that? Well, it's a procedure where there is a risk of miscarriage. And why do you want to get it? Oh, hey, Hannah, first time watching. Oh, okay, great. Thanks for hopping on. Hey, Anita, my friend Anita. Yeah, I know it's hit or miss with these live videos. I know everybody's on here doing their thing. I'm here to share what I know and ask questions. I just want people to want to know more about birth, and I'm not sure how to make that happen. Doesn't seem like many people are taking childbirth classes. Maybe they're searching online, but I don't know where they're searching and where the information's coming from. So I would like to share what I know, and it's always in the form of a question. So I'm here to say that just because you're 35 or older, hey, I was 35 when I had my second son, and I was healthy, and I didn't have any reason for any tests or procedures, because the question is, what are you going to do with the answer? Are you going to terminate your pregnancy if you find out that there's a problem? And what are you going to do with the test? That's one really great question. Go back to that brains model of decision making. Benefits, risks, alternative, your intuition. Is there really a need? And is it safe? And will it lead to a satisfying outcome? Okay, Onita was 40. See? Yeah, you were 40 years old and you said, no, I don't want an amniocentesis. I don't want to know. If you have other risk factors plus your age, I'm sorry, I think I'm itching ants over here out in my outdoor office again. But yeah, ask questions and know what the test is. You know, are there any risks? That's another thing. Just, are there risks or benefits, and what are they? Always weighing it out. And with any test, what are you going to do with the result? And that's the whole thing about an amniocentesis. It might tell you that your baby, there's something wrong, which it's not always accurate. And then what are you going to do with that information? Are you going to keep your baby and worry the entire time? Are you going to terminate your pregnancy? You know, what are you going to do with the information? So you have a right to say, no, I don't want that. Or yes, I do want that. And that's what this is all about. It's about your choices and standing in your own power. Hey, Christina. NIPT is unfortunately more common, and that reduces recommendations for amnio. Christina, clarify, please. NIPT. I don't know all my lingo. See, I don't know everything. I know you're a midwife, Christina. Tell us what you're referring to. Anyway. We'll get some clarification on what you're asking, or what you're stating. And thanks for hopping on, by the way. Look, I don't know everything. I just know that maternal age is not an automatic risk factor, and doesn't require you to necessarily get any additional testing. But you should know what the test is. You should know about your own health and what your desires are, and trusting your care provider, your midwife or your doctor. That's one of the things too, is trusting what they're recommending, but also doing your own homework, and ideally well before you're in it. This is all good to do way before you're pregnant. Okay, non-invasive prenatal tests can be done as early as 10 weeks. Oh, okay, so you're saying now that it doesn't even matter about age, that these tests are happening even earlier? Is that what you're saying? Oh, I hope not. But yeah, I think that's what you're referring to. So in other words, yeah, they can be done early. Wow. Again, it's asking the questions of why and what is the test for. And yes, I mean, when we're younger, typically, we're healthier and more sturdy, but that's not always the case. I'll tell you what, I'm getting up in age, and I see some younger kids that can't do half of what I do. So, in that respect, age isn't always a factor. Much more accurate than AFP testing and reduces need for amnio. When NIP is normal and ultrasound's normal, then amnio isn't indicated. Okay. So, but it is still, all of it comes back to, even with an ultrasound, I talked about that at another time. Yes, is there something that there's a suspicion of something wrong that needs to be checked further? So none of it has to actually be routine, like none of the testing. But yeah, there's always that, have one test and then it's unclear, unsure, then the next one follows, and you get into that whole cycle, right? So the amnio is suggested to confirm abnormal prenatal testing, ultrasound. Okay, so yeah, it can be, because it's after the ultrasound, the next step would be an amnio. So I guess the question is too, if you're getting an ultrasound, what is the reason for that initial ultrasound? What's going on? Is there something wrong that is detected on some level? Routine ultrasounds aren't really recommended necessarily, but I know that they happen every day, all the time. Women should understand their options. Yes, it's their choice. And you're correct, age is not a guarantee. Right, yeah, that's what I'm saying. This whole thing and all these videos and everything I'm doing with my work is about, I want people to want to know more, and I want women to stand in their power and ask the questions, and I feel that being pregnant is oftentimes too late, but again, it's never too late for education. But a lot of this information to learn about early on, or just to simply know that you can ask if you don't know what something is. And if something is routine and done all the time, that doesn't necessarily mean it's a good thing, right? Think about some of the routine tests and procedures, even in other healthcare circumstances. And of course, pregnancy is not an illness, right? So we treat it like one. It's asking the questions and just being your own advocate, and hiring a doula would be great too. You have another advocate. Informed care. Yes, Shauna, exactly. And I know that, Shauna, you teach childbirth classes, right? Are people attending? I'm hearing from a lot of colleagues and people that I know that there's very low attendance. I know in my area it's sometimes a challenge to get people to come to the classes, and I'm dreaming up ways to shift that somehow. Yeah, so we're teaching a lot about childbirth at 7 months pregnant. And it's very late in the game. I was talking to this awesome researcher today, Catherine Stahl. I'm giving you a plug. She's doing all this research about fear and when that begins, and it's really early on. And she even shared about a model in Germany where the midwife goes into 3rd and 4th grade and teaches this 4-hour class in 2 days all about birth, and the kids love it and they have so much fun. So they're learning early about birth and the normalcy of it. Hey, Jamie, how are you? Bring them on camera. Bring who on camera? I'm confused. Okay, most students are second-time parents because they've had a bad experience. Yeah, that's true too. A lot of people don't go to classes and think they can find everything online and ask their girlfriend, and they got it. And there's something to be said for information overload. I'm a proponent of education, and I think knowledge is power. But there is still the whole thing about learning all this stuff and then getting out of your own way and being present and trusting. Your body knows how to give birth. You already know how to do this. It's just all this other stuff coming at you, this information, these tests, these procedures, and it's really not that confusing, but it is made to be very complicated and confusing because of the technology. And as a matter of fact, the researcher I spoke to today said in the U.S., women love the technology, and they don't have a very good attitude, or well, not good attitude, but a certain attitude towards midwifery, different than in other countries. So what is it? What's going on here in this country? Like, why is this happening? I know there's a lot of reasons, and there is no quick fix answer. That I understand. And I'm on a mission of education. I want people to want to know more about birth. I want them to learn earlier rather than later. You know, maybe classes get to be a mix of online, but sending people to the proper information, and then getting together in groups a few times throughout the pregnancy for something really special. I don't know. Just ideas, calling it something other than a class. This is some research I'm looking into as to what the attendance is in classes, and when people do have a lot of people coming, what are they doing? How are they getting them there? And I think there's so many different things now. You've got dancing for birth. I mean, yeah, let's just get into the whole movement and the mindfulness, you know, end of story maybe. Hey, Tiffany. I don't know. I don't have the answers. I like to ask the questions. I had to put my glasses on so I can see who's hopping on. Seems like this is a good time of day, and I'm sorry for I think I'm stepping in an ant pile here. I don't like shoes. Anyhow, the main question in the beginning of this was about maternal age, and is that a risk factor in and of itself? And the answer is no. And then we got into all these tests and procedures and questions and everything that pregnant women are bombarded with. And my whole thing is, let's learn about birth earlier, and let's know what our options are, and then be able to practice that trust and surrender, and that hone in on the whole intuitive nature of ourselves, because birth is intuitive. Knowledge is power, and birth is intuitive. As Michelle Odent would say, just let a woman be in a dark corner and leave her alone. And that's all well and good if someone is emotionally prepared and trusts the process, right? So I still think we get to have a mix of some type of education. We need to change our dialogue about birth, share our good stories. Yeah, moms who have good or natural experience are shamed and called martyrs. Yeah, that's silliness. I don't know. I was afraid to get a needle in my back. I mean, that scared the heck out of me. So listen, you have to feel safe, right? But yes, let's share the stories that are normal, and we know that in medical school they very rarely even see a normal birth, so, or what we're now calling physiological birth. So there's a lot to this equation. There's no simple answer, and there's so many great doulas and educators and midwives and organizations in this country, in the U.S., that are doing some amazing things around birth. And it's all awesome stuff. I just wonder if there's some other ways to get the information out and in people's hands earlier, and that we can see some type of a shift before I leave this planet. Hey, Christina, how are you? Oh, hey, Sarah. How are you? Thanks for hopping on. Yeah, I usually am pretty much on here solo, but I've been in this mode to share every day, ask a question, and feel free to share what your thoughts are on maternal age, and is there a specific cutoff at a certain age, or a specific age where you're more at risk because you're usually it's 35 and plus. You know, is that necessarily true? And I'm here to say no, there's never a one size fits all. It's impossible with birth. You're asking the same questions, keep them coming. Oh, thanks, Shauna. Okay. Oh, what am I going to do? Bring you on camera? Is that what I can do? Is that what that is? You want to be a guest? Oh, that's something new. That's what that is. Invited you, Shauna. That's so funny. I didn't know that existed on Facebook Live. Technology's changing every day. I'm such a goof when it comes to technology. Oh, it takes me like hours. It takes someone 5 minutes. Anyway, off topic, but birth is a normal, physiological, amazing, transformative event in a woman's life. And I believe that women get to be informed and come from that place when they choose, and also be dealing with whatever their beliefs are about birth, and just kind of getting rid of all of them and start over and just be willing to challenge all of that to be in a good place when they get to their birth. Oh, your kids are kind of loud. Oh, that's okay. I didn't know there was like an add someone in now on here on Facebook Live. That is like so cool. I love it. I really do. That's amazing. Yeah, hop on if you want, Shauna. I sometimes have the dog barking out here. He's actually over there. Usually he's behind me. It's really getting chilly tonight. It's going to be in the 50s in Florida. Woo! Maybe we'll light a fire. I have a campfire right in front of me here. Anyway, yeah, I love to hear from you. I love to hear the comments. It makes it a little bit more exciting. And please share. Feel free to share, of course. It's Betsy with Birth in the Know, in case you're just hopping on or you're watching halfway through when you see it later. And if you want to have, well, not have, but if you desire an amazing birth experience, it's something that you can have, because we're always creating our life and our experiences, and it's no different in birth. And I believe that you get to ask all the questions. I just created a, I don't know, 13, 14-page little booklet, The Ultimate Guide to Birth, Evidence-Based Resources. So that's on my website if you want to grab a copy. You can head over there and do that. Or just check out my blog, see what else I'm writing about, see what else I'm doing. I also have my game, Down the Canal, The Game of Birth, which I'm sharing everywhere and anywhere. And I'll be traveling again. So, Shauna, I will see you. Yes. So after January, I'll be going around the country. And actually, even now, I actually just put together another class that I'm offering. A little side note, the Forgotten Fourth Trimester. And I can come to you to do that. So those are some of the things that I'm up to, all in the name of sharing and education and creating a shift in birth from the cesarean rate that we have. And it definitely has everything to do with what hospital you walk into. No doubt. That's pretty clear. So we get to look at that too. Where to give birth. That should be on another video. We'll talk about that a little bit more. Anyhow, all right, I'm spewing quite a bit today because it's good to have a little conversation going. Oh, hi, Gio. Oh, the class with the CEUs. Yes, so I have a class called The Forgotten Fourth Trimester, and it's a snippet of the postpartum period of what comes after birth, which I believe, of course, is part of the whole birth process, and we don't pay a lot of attention to it, sadly. And so it's a 5-hour course approved by Lamaze. I just got the approval for 5 CEUs through Lamaze for additional education. And we're going to look at how that birth affects what comes next, and that it's a whole full cycle. And we're going to just take a little bit of a look into life in the early days and weeks with a newborn. And I do role play, of course, and groups and individual activities and fun interactive stuff like I like to do. So I'm offering that now and looking for places and dates and reaching out to people. So, oh, you're doing your postpartum doula certification? Yeah. Well, I was a postpartum doula trainer for umpteen years, first with Kappa and then with Dona.
and now I've kind of just gone off on my own, so I'm offering a little bit of a snippet course on the postpartum period rather than the 3-day and the whole certification thing. So yeah, I'll share that with you. Oh, hey, Mylene. All right. Well, anyway, I have spewed enough, I think, probably, right? Usually it's a lot quicker, but it's been fun chatting a little bit back and forth. Now I know I can add someone on and then come on with me live. I love that. Just go for it. This is my challenge to myself. Once you do it a day, 2, 14, it gets easier. Betsy with Birth in the Know, with my question of the day about maternal age and being pregnant. And check out my website, share these videos, hop on again. Maybe I'll just try doing it in the afternoon. It seems to be maybe a better time for people. So we'll switch it up. This Saturday I go to Atlanta to the MommyCon event and do my fun factor. Little game playing and some fun action over there. So, all right, everybody, have a great afternoon, rest of your day. And I will be back tomorrow afternoon around the same time. So feel free to share. And we'll see how it goes with an afternoon gig on Facebook Live. All right. Talk to you later. Bye.